This is a download from BFM 89.9, the business station.
Welcome to Health and Living. I'm T. Xiao Ik. The process of diagnosing a cancer often involves a tissue biopsy where a sample of cells or tissues is taken for the consulting doctor to come to a concrete diagnosis. But the process can be invasive and getting the results could take several days. Today, however, we are talking about liquid biopsies, which are supposed to be less invasive and could be key in the earlier detection of cancers. So to help us understand more about the role of liquid biopsies, as well as next-generation sequencing in detecting and treating cancer, I'm speaking today to consultant clinical oncologist Dr. Muhammad Ibrahim Abdul Wahid. What exactly takes place when you run these next-generation sequencing tests?
Liquid biopsy, normally we take it from the blood because liquid biopsy, we rely on something called circulating DNA. What happens is normally liquid biopsy we do for patients with advanced stage cancer or stage 4 cancer when there is a bulky tumor in the body and the tumor is shedding. It's what we call genetic material or DNA that may be circulating in the bloodstream. And so with a liquid biopsy, we take a sample of the blood and we then spin down or get the sample of the circulating DNA in the blood to do the testing. So these cells are no longer in the tissue, they are shedding. Yeah, the cells are shedding the DNA and that can be detected in the blood.
And speaking of false hope, if the NGS testing comes back with mutation that can be targeted with certain type of therapy, there's also the fact that targeted therapy like immunotherapy is very expensive. So what happens if a patient does NGS, but then the road ahead is still, very expensive treatment? How do you help them manage those expectations? What options do they have?
Now, generally, what the NGS do is they normally they test for drugs that are currently available in the market. No point. There are one or two companies that are testing for drugs that are, that are still not so-called registered. So I don't use them because it's not practical. When you find something and then this drug is not available. No, but some of the tests like the liquid biopsy, but like Guardant360, they give practical solution. They tell me about the drugs that are currently available that I can use to help to treat my patients. So generally, when they recommend something, I will be able to access those drugs.
What about cost in terms of public resources? Is NGS testing at all available in the public sector?
It's available in all sectors, but you have to pay for it, because at the moment
so it won't be covered.
It's not covered. Sometimes it's covered by some insurance, but I think what we also need to do is to educate some of these insurance and also third-party payers, on the benefit of these, because it's not currently widely available and not widely available. It is available widely. There's so many companies offering it, but it's not widely used because I think a lot of doctors are still, need to have a feel and understanding on how to use this technology. But once you use it, like something like the Guardant360, once I use it, I find it so useful that it's I try to recommend to almost all my difficult to manage stage 4 cancers, because I've seen the benefits and I've seen how many lives it has helped. So I am convinced, but we need to convince a lot more doctors on this technology, and also make patients aware that these are technologies that's available.
All right. Dato Ibrahim, do you have a final message about next generation sequencing?
Yes, certainly. I think, next generation sequencing, NGS, especially like using things like liquid biopsy, is a game changer. It has helped us to identify some difficult cancers, rare to treat cancers, and and trying to find the right drugs to match or tailor make these patients' treatment. So I think this is something that should be in the near future integrated as part of our clinical management of patients with late stage cancers.
Thank you very much.